everyone, and thank you for being here. I am Representative Carly Katiza-Wattoon, and I represent District 49B in Eden Prairie in the Minnesota House. But my favorite and most important title is Mom. Outside of the legislature, I'm a full-time parent, and as mom to 4 children, 10 and under, I know that the struggle is real. They're constantly eating, and they grow out of clothes and shoes in the blink of an eye, but those costs are relatively small compared to the costs of early care and learning for Minnesota families. Childcare is by far the single largest expense families of young children have, and this continues as many families need before and after school care through elementary school. Infant care is expensive, costing around $17,000 a year per year across the state, and that's more than a year of college tuition at the University of Minnesota. We are asking young parents who are often at the beginning of their careers, at their lowest earnings potential, to shoulder this cost alone. The federal recommendation for child care affordability is that families should pay no more than 7% of their annualized income for child care. Considering the cost, families would need to make upwards of $300,000 to pay just 7% of their annual income. In Minnesota, only the top 5% of income earners make $228,000 or more, still far shy of $300,000. So really, only the wealthiest among us have access to child care that is affordable for them. Currently, if a family earns more than $60,000, they're no longer eligible to receive existing child care subsidies. Again, that average cost for infant care here in Minnesota is around $17,000. If we do basic math, paying for one infant at a cost of $17,000 leaves a family making just over $60,000 with only $43,000 before taxes to pay for the necessities of life. The math doesn't math. It's impossible. And there's so many among us who are living that truth. We can and we must fix this. Every child in Minnesota deserves a great start to life, and we all benefit when that happens. The Great Start affordability proposal that Senator Houschild and I are bringing forward would lower the cost of child care for families making up to 150% of the state median income, or about $775,000 a year. We plan to utilize existing payment infrastructure, which would allow us to get the program up and running more quickly and bringing help to Minnesota families faster and more efficiently. We have the opportunity with this proposal to make a huge impact on the lives of thousands of Minnesotans. Every family deserves access to quality child care at a rate that they can afford. The Great Start affordability program will bring us one step closer to making Minnesota the best place to raise a family. And with that, I am introducing parent Alexandria Packard to share her story.
Good afternoon. My name is Alexandria Packard, and I am from Minneapolis, Minnesota. I am the mother of 2 young children and a leader with Kids Count on Us. I am grateful for the opportunity to share my story with you. I have a 5-year-old son who will start kindergarten in the fall. I also have a 1.5-year-old daughter. I work full-time in Fairview Healthcare System. My husband works full-time with the Canadian Pacific Railroad. He travels Monday through Friday for his job, which leaves me single parenting during the work week. We do not qualify for child care assistance, yet our income is low enough that if Minnesota met its goal to have no family pay more than 7% of their income of child care and early learning, it would be free for us. I work from home 3 days a week. On Tuesdays and Thursdays, I have to be in office. My son goes to child care the 3 days I work from home. My daughter went to child care those days a week as well, but I had to take her out because we cannot afford to pay $500 every 2 weeks. It would be more than $12,000 a year for only part-time care. On Tuesdays and Thursdays, my grandmother takes care of both of my children while I'm in office. I'm 32 years old, and my grandmother is caring for her great-grandchildren because we cannot afford child care. And if you're tracking, you're likely wondering who cares for my daughter the 3 days a week that my son is in child care. I do, which is why she is here with me today. I work and I care for my daughter at the same time, and apparently now I speak to the media and care for my child at the same time. She was an easy infant, but now she's into everything. I feel like I have to be a child care teacher at the same time I'm trying to do my full-time job. And yes, I can confirm that child care teachers deserve to earn way more than they do. I had the opportunity to take a job with the railroad that was a huge pay raise over my current salary. I found out that I'd have a rotating shift, which was impossible because of my husband's work schedule. Even if I could have found childcare for those hours I needed, the pay raise would have eaten up by paying for full-time childcare for both kids. It is incredibly frustrating to have my career path dictated by childcare costs. If this legislation passes, we could afford to put my daughter in childcare where she would get the attention she deserves. I would have the opportunity to move into a job in healthcare that pays more money. There are jobs out there, but you have to work in office. And with affordable childcare, I could. We are in the process of buying a home. Every month, we have to pick and choose between which bills to pay and how much we can put away for a down payment. It's not a fun way to live. 2 full-time working parents with 2 children should be able to afford their lives. Thank you. I would like to introduce Maria Isa Perez Vega.
Buenos dias, good afternoon. My name is Representative Maria Isa Perez Vega. I represent the District of 65B in our capital city of St. Paul in the suburb of West St. Paul. I'm also a mother, single mother of a 4-year-old and a member of our wonderful Children and Families Committee. I want to thank my colleagues and Representative Carly for addressing this, as well as our senator. This is an impact that we need to address here. I believe that the importance of childcare affordability shouldn't just be a concern. It should be an addressing of what we're looking at as a secured necessity, a way of life that needs to be implemented in our everyday lives and concerns. Every parent of a child, whether you have 1 or more in a household, have been affected by continued winds of this inequitable situation. My colleagues and I are strongly and collaboratively working together to not only address the issues, but to create solutions that will lead and foster a lasting impact in our child care system. It's all the questions that go up in the air. We're dealing with inflation. We're dealing with unaffordable housing. We're dealing with all the good things that we've been able to tweak in our last session. This needs more of a boost, an Energizer Bunny. Let's go solar for childcare. We have historic legislation. Let's continue to make that, and that's what we're doing here in this 2024 session. When we talk about implementing policy to making that great suggestions, no, they're not suggestions. They're the priorities lead. We're addressing this just as much as we need affordable health care, just as much as we need environmental justice. Our children and working parents like myself, who if it wasn't for a village, because it takes a village to take care of a kid, but that village needs help. Parents need help. Full-time workers need help. Part-time workers. If we're talking about childcare, we need to also highlight workforce and the opportunities that that makes. I come from a grandmother who was a childcare provider who didn't speak English, but she spoke nurturing. She spoke nurturing and took care of kids who spoke different languages in her household. And I think about those values when we're addressing the need and the concerns of affordable child care. Everyone deserves a space. Our child care providers deserve more. And most importantly, those kids deserve the effort to have that early childhood education and nurturing just as much as my abuela did to so many. We need to talk about the benefits of investing in the child care affordability, increase labor force participation and economic growth. When we talk about where are the jobs, where's the employment, this is an avenue to not just talk about it, but to make it a part of this year's priorities. Muchas gracias. And at that, I'd like to introduce a parent who drove, because this isn't just a metropolitan area to address this issue. This is a greater and rural Minnesota issue as well. And with that, I'd like to invite the parent from Moorhead to speak next. Hi, Alina. Thank you.
Good afternoon. My name is Elena Skoglund, and I am from Moorhead, Minnesota. I am the parent of a young son, a childcare teacher, and a leader with Kids Count on Us. I'm glad to be here representing the thousands of families across Minnesota who have stories just like mine. My husband and I have one son, Harvey, who is 2.5 years old. We had hoped to have a second child by now because we wanted kids close in age. Without hesitation, I can say the number one reason Harvey is still an only child is the cost of childcare. I am a full-time teacher at the Early Education Center at Minnesota State University Moorhead, where I teach 3- and 4-year-olds. My husband works full-time as a police officer for the city of Holly. Together, we would make too much money to qualify for childcare assistance, but not nearly enough to comfortably pay for childcare. Growing up, I was told that if I worked hard and got a college degree, I would be able to provide for my family. I am a highly qualified, college-educated early childhood professional, as are my fellow teachers. Yet, I make barely $40,000 a year, which is at the upper end of the pay scale. Even with state funding, early childhood teacher wages are still largely dependent on what families can afford to pay, and families cannot afford to pay anywhere near the true cost of care. Our child care costs for just one child eat up 50% of my annual income. 50%. If we were to have a second child, my entire salary would go to pay for childcare. High quality and early learning is expensive to provide, just like K through 12 is expensive to provide. Yet, we ask young families to shoulder the burden of this cost until their children are in kindergarten, which adds up to tens of thousands of dollars. It's crazy to think that families can possibly afford this, and it's crazy that we ignore the fact that a child's brain does most of its growing between 0 and 5. It is exactly the time we should be ensuring every child has access to high quality, affordable early learning. The early childhood teacher wage supports from the state are welcome and necessary, but they are just a Band-Aid. The retained grant I received last year, designed to help supplement income for early childhood educators as they work to establish a career in the field, covered just 2 months of my childcare and a grocery run. We are 2 full-time working parents, working in careers that are vital to the thriving community, and we can barely support 1 child. We need teachers, and we need police officers. And a thriving community needs doctors, plumbers, bus drivers, cashiers, nurses, and many others. And we all need childcare that we can afford so we can do these jobs well. We are decades overdue in addressing the childcare crisis. I am excited that this legislation to reduce childcare costs for families is in motion because Minnesota families cannot wait any longer. Thank you. And I'd like to introduce Senator Grant Hochschild.
She got the name right, so that's good. Thank you so much. Excellent testimony. Well, I'm Grant Hochschild, for those of you I haven't met, and I have the privilege of representing the most rural and largest district in Minnesota. So when I approach policy challenges and the issues that our communities face, I try to take that lens of what impacts our rural communities most. I've done 3 child care roundtables all across northern Minnesota and some of the most rural areas in Minnesota. And I can tell you without a doubt that childcare is one of the top issues that I hear about, not just from families, but I hear it from businesses, I hear about it from community leaders, I hear about it from prospective businesses that want to open up shop, I hear it from small business owners looking to expand. This childcare issue impacts all of us, and it's about the vibrancy of our communities. So we have to do something to address this big challenge. In fact, when I go to my rural communities, some of them literally do not have childcare slots or childcare available. So when you're talking about businesses growing, when you're talking about retaining the young people in your communities, how do you do that when you don't have childcare available at all? This is the challenge that we face in greater Minnesota, and you heard from folks here, urban, rural, suburban, it doesn't matter. This issue impacts all of us equally. And we need to figure out how we're going to address that for our families so that we can have a growing population for everybody. I'll give you one example. I was recently in Ely, and I met with a leader in one of the businesses there in town. He talked about how he had to work a flex schedule, sometimes starting as early as 4 a.m. and working late into the evenings because there wasn't childcare available for him and his 3 kids. This is somebody working in a leadership position with a business, providing quality business and opportunities for this rural town, and he couldn't find childcare. And that is why it's a market failure. We can't pay childcare providers enough to thrive. You heard that testimony earlier. And we have families spending more than their mortgages on childcare. This is a fundamentally broken system, and we have to do something to address it. I have a personal experience in this as well. I have a son, Henry, who's 4 years old, and a daughter, Isla, who is 2 years old. My wife is a frontline healthcare worker. We wouldn't be able to do the passionate work that matters to our communities if it wasn't for the childcare that we have. And the sad truth is, my wife was with my son and daughter recently in Target, and all of a sudden she hears from behind her, "Henry, Henry, Henry." And she looks back at somebody at the cashier, and the woman goes, "Oh, I'm one of Henry's childcare providers. I'm on my 3rd job right now working here at Target to get by, but I just saw Henry. I love caring for him, and I wanted to say hi." That shouldn't be the case. We have educated professionals helping raise our children from age 0 to 5 years old that are getting paid sub-minimum wages that don't allow them to live the lives that they need. And that's a tragedy, frankly, in my mind. We have families delaying having kids, and we have a Native population that is continuing to decline, and we have population across our state that we need a workforce enabled to thrive. So this is a challenge that I think impacts all of us, and that's why I'm so thrilled to join Carly in representing this bill and representing our communities on this legislation. Last session, we did a lot for childcare. We provided stabilization grants for our childcare centers. We provided some increases in wages for our childcare providers, but now we need to focus on the middle class. This bill that we have before us would impact families earning anywhere from $50,000 a year to $175,000 a year. Middle class families trying to make ends meet. And the goal is that no family in Minnesota will pay more than 7% of their income on childcare. And this is up to 150% of the median wage. As one example, in my home county of St. Louis County, a family of 4 would pay no more than, or would get a break of $5,400 a year. This is real money back in the pockets of our families being able to be used on the core costs that they have. So before I end, I just want to make one final point. Some folks might ask, why are we doing this just for families of young children? That doesn't impact all Minnesotans. What about seniors? What about older families that maybe don't have kids in childcare anymore? We've done a lot in Minnesota to have each other's back, and we do the things that we need in order to make sure that families can thrive. Last session, we did Social Security tax relief, $1.2 billion worth. We did $300 million in nursing home emergency funding. We did education funding for our young people. Now it's time to focus on our young middle-class families, and that's exactly what this bill does. So I hope you'll join us in supporting the Great Start Family Affordability Care Bill. Thank you so much, and happy to answer questions.
Any idea of the costs associated with this, and would those costs be any sort of barrier to getting this bill passed, considering last year's spending?
Yeah, absolutely. I mean, I think it's important to note that right now we fund education, right, as a public good, starting at kindergarten to 12th grade. And that's a cost that we continue to burden every single year because we know that that's a public good. I think what we're saying here is that we should start thinking about ages 0 to 5 as a public good so that we can get to a point where we're providing those core services. This bill is scalable. That's kind of the beauty of it. So we can look at what funding is available after the forecast and how this gets prioritized and sort of look at where we might be able to fit it in. But the goal is to highlight the challenge, to showcase that we need to address this for middle-class families and see where we can get.
When you talk about scalability, can you speak a little bit to what that might look like? I mean, are you going to come up with like a lump sum that you can dedicate, and then how would you prioritize the distribution of that? I'm curious about kind of that specific aspect of it, and then kind of what the process will be for after the forecast comes out, determining what that number looks like.
Sure. Absolutely, and thank you for that question. So when the senator says that the proposal is scalable, it means that the total amount that we are able to invest in childcare affordability this session is scalable. But then as we break down the proposal itself, that it's scalable based on income level and then number of children. Right now, we're looking at a minimum payment of about $25 a month toward this affordability program that the providers would receive on behalf of families who are earning the highest level at that 150% of the state median income. And that could go potentially up to $600 a month, depending on how much families are earning on that sliding income scale. I hope that helps.
Yeah, so once you kind of make the determination of how much money could be allocated to this program, would you be looking at, prioritizing the families that are on the lower end and then maybe not having payments for the higher end? I guess that's kind of what I'm trying to get at.
Sure, okay, thank you for the clarification. Yes, so, our goal is to ensure that we can get the most help to the most Minnesota families. But when we look at the folks who are still needing the most help, it does fall right around that $60,000 a year mark, simply because they're just on the other side of this cliff. And so of course, yes, we would try to prioritize relief and support to the families who are earning on the lower end of that income scale, because we know that things are tight for them, and we certainly want to ensure that folks higher up the income scale have a sense of ownership, that we're all in this together, and we know that childcare costs continue to go up. At our November informational hearing, we heard from a childcare provider who had to increase the weekly fee, and if that breaks down to if it was $7 a week or $17 a week, we're really trying to help support that increase in costs for some of those families who are making more money than the lower income families.
Do you have an idea from the industry whether they could ramp up to handle the increased need, to have the capacity to handle the additional families that would be getting child care?
Sure, that's a great question as well, and we're structuring this proposal to use the existing Early Learning Scholarships program, which is going to be a tremendous help. Currently, the Department of Education works with these programs and gets the money out to providers. A lot of the community, the initiative foundations work in getting that money out to providers as well. So it's something that we've thought of, and we want to make sure that it's as efficient and as effective as possible.
Yeah, and I would just add, you're exactly right. I would just add that one of the beauties of this program is that it's a direct payment to the providers to then provide that subsidy on the bill for the families. So it really provides some certainty to the child care providers. So I think the hope is that this also provides stabilization for the child care industry, helps them open up shop in more rural areas, some of those sort of net benefits.
But that scholarship moves with the student.
Yes.
That's correct.
So you demonstrate that you have a student, they've given some sort of income levels to determine what the payment is, and then that payment goes to the provider, and the provider reduces what you would be charged on a monthly basis.
That's correct.
That's right.
Right. Well, thank you all so much for being here today. Thank you for the advocates and our colleagues who came to stand in support. We are, as young parents ourselves, we just know that this is going to make such a big impact on the families of Minnesota, and we appreciate you getting the word out to folks.
Thank you.
Thank you. Thank you all. Thank you.